Welcome back to the Caregiver Minute, where every weekday family and professional caregivers gather to refine their skills, gain inspiration, and prepare to serve. One of the biggest challenges in the professional healthcare world right now is staffing and engagement. And I was recently invited by a couple of healthcare associations to do a presentation on how to increase employee engagement. How do we keep people in the workforce, giving their all, doing their very best at a time that many people are leaving the healthcare field? In fact, at a time that many people are dropping out of the workforce entirely. Now, it's not just professionals that are facing some of the consequences of this. Many family caregivers who expect to have personal care agencies and home health agencies, hospice agencies, or assisted living or skilled nursing communities for their loved ones, filling the bill and being part of the healthcare team for their loved ones, are finding that it's tough to find really good resources because of the lack of engagement on the part of some people in the workforce. So I wanted to share some of the things that I learned as I dug into the social science research related to engagement. The most impressive thing that I learned and realized is that workforce engagement has been a problem long before the COVID pandemic hit. Right now, there are a lot of people who are blaming the current challenges that we face with our workforce on the pandemic. But there was really good research done in 2015 and repeated again in 19 countries in 2018 that showed that 84% of the workforce was unengaged. They were showing up at their jobs, they were collecting their paychecks, but they were not fully invested in what was going on. I don't think the COVID pandemic caused our workforce problems. I think it exposed problems that were already there, problems that we all co-created in our societies. So what do we do about this? Fortunately, the research that I dug into for this presentation had some really important insights. They found, for example, that a much higher percentage of workers were engaged if they simply reported that they felt like they were part of a team. Well, whether you're a family or a professional caregiver, you need a team. Nobody can do it alone when it comes to serving people living with dementia or other chronic health problems. We need the support of other family members. We need the support of friends. We need the support of professionals. If we're in the workplace, serving people in an assisted living or a skilled nursing facility or a hospital or any other healthcare setting, we need our teams. And so if we view that we're part of a team, it makes a difference. So that leads to the question, well, what makes for a really good team? People were more engaged and felt better about their teams if they felt like they had a leader that they trusted. When people reported that they had a leader at the head of that team that they really trusted, their engagement scores went up even higher. So what makes for a trusted leader? The research actually showed two key things. Number one, people were more likely to trust their leader if they had a clear understanding of exactly what they were supposed to be doing and what success looked like. So we can be clear with those around us. We can really paint a clear picture of exactly what it is that they need to be doing and how that contributes to the success of the overall operation. Number two, people felt like they trusted their leader when they had an opportunity to use their strengths, when the things that they were good at mattered and they had plenty of opportunities to put them into practice. I think there's a lot that can help us in family and professional caregiving situations if we will just recognize that people need to feel like they're part of a team, they need a leader that they trust, and they're more likely to have that trust when they can see exactly what they're supposed to be contributing to the team and they have an opportunity to use their strengths. If we can just focus on those areas, I think it will make a difference in how people feel in the workplace. Now, we're talking about a really complex problem when it comes to people's engagement level with an important endeavor. But I hope that today gives you a little bit of food for thought, some things to ponder that could make a difference in your life and for the people that you're serving and the team that you're serving them with. Thanks for watching, and I'll see you again soon for another episode of the Caregiver Minute.